Don't do my password video, huh? Yeah. So now, can I have the baby's URN? Did my patients come in? This is too difficult for me to see the screen here. 211? Yeah. 914. So, no.
So this word, doctor. Two 914.
This one, baby of Fatima, right? So you will go here as usual. You will put your notes, okay? And you also have to inform the pediatricians to put this diagnosis, okay? So you can do that. No, yeah, in the diagnosis, pediatricians will put. They'll know. You can see that you did the examination of ear and hearing without abnormal findings, Z01.10. All right. If you find any problems, encounter for hearing screening, not this one, this with abnormal findings, with or without, right? That's all. So this is for normal, without abnormal findings. If you find any pass or refer, it is abnormal. Okay, both are pass without abnormal findings. In this baby, it is encounter for examination of ears and hearing without abnormal findings, updated. So this option, I don't think you have it in your track here. So you, once you finish your screening, you can inform the concerned pediatrician who is responsible for the baby to put this diagnosis there. Once you put this diagnosis, irrespective of any machine you are using, doesn't matter to us, because this is the diagnosis we are going to track. Whether, for example, now after 1 week, baby came to Dr. Hakam's clinic. Dr. Hakam says that, did you do the hearing screening? Mother will tell you, I forgot. Do you have the vaccination book? I don't know, I forgot at home. So Dr. Hakam can directly check here and see that this is done there, right? So even if you don't put the notes or etc., doesn't matter. This is indication that baby is hearing screening is done and baby is normal. And also with abnormal findings, again we know that we did screening, there is an abnormal finding. So then of course you can ask them to put the orders. And in my case, because mine is a clinical one, so you may not see that, and I will put the Algopac screening. That's it. Simple as it is, right? So only thing you will do is you will do the screening and you will put the stamp and you will inform only the pediatricians to put the
It will come.
It will come here, yes, that's why, because it's a black and white. So that's why I told you we don't have to worry about the printer, about that machine, because that keeps changing every time when they take it for calibration or changing the screen, etc., etc. So we don't rely on that completely. And if you want, I can show you my notes, for example, review of. Yeah, you can, maybe if you want, you can select one of these notes. I put it like this, right? Newborn hearing, whatever time on date, we'll put it. Of course, place you can put respective of OB/GYN, ICU or pediatric, and these things, and here, bilateral ABR screening, pass at 35 dB. So this will be constant for all these are constant for all the babies except the date, time, and the number of days and the gender. So if it is failed, you will put it as bilateral screening, not pass. Here see, pass will remain as a fail or refer. This one, this particular terminology will change.
But what's that 35, doctor?
These are all what you did in the procedure. So what you did, for example, you did the procedure by using this machine, by giving the sound. You did it both the ears, you put the electrode sensors, everything there on the forehead, nape and all those things, shoulder, and the noise is expected to be less than all these things. So this is constant for all the babies. If anything changes from here, you cannot do that, as I told you. That impedance is very high, it automatically stops. So you can do that. You can take a
Sure.
yes. So that is done, and sorry. Yeah, so, and where is it? Update. That's it. خلاص done.